Discuss the implementation challenges of telehealth in physical therapy practice. What strategies can practitioners employ to overcome these challenges while ensuring effective patient care? Answer: telehealth has emerged as a vital component in physical therapy, especially in response to the COVID-19 pandemic. However, its implementation faces several challenges, including technology barriers. Not all patients may have access to necessary technology, e.g., smartphones, computers, reliable internet. Practitioners should assess patients' access to technology before scheduling telehealth sessions and consider alternative methods, e.g., phone consultations when necessary. Legal and regulatory issues. Different states have varying telehealth regulations. Practitioners must stay updated on state licensure laws regarding telehealth delivery and ensure compliance with HIPAA regulations to protect patient privacy. Clinical efficacy. Some interventions may be difficult to convey virtually. Practitioners can employ demonstration videos or virtual reality tools to enhance patient understanding and engagement during sessions. Reimbursement challenges. Insurance reimbursement for telehealth services varies. Practitioners should familiarize themselves with insurance policies and advocate for equitable reimbursement for telehealth services. Explain the significance of evidence-based practice in physical therapy. How can physical therapists effectively integrate BP into their clinical decision-making? Answer: evidence-based practice is crucial in physical therapy as it combines clinical expertise, patient values, and the best available evidence to inform decision-making. The significance of BP includes improved patient outcomes. BP ensures that interventions are grounded in scientifically valid research, leading to more effective treatment plans and better patient outcomes. Standardization of care. By relying on systematic reviews and clinical guidelines, BP promotes consistency in treatment approaches across practitioners. Informed decision-making. BP encourages therapists to critically evaluate research, fostering a culture of inquiry and continuous learning. To integrate BP effectively, physical therapists can stay informed, regularly review current literature, attend workshops, and participate in professional networks. Utilize clinical guidelines. Implement established clinical practice guidelines relevant to specific conditions to guide treatment planning. Incorporate patient preferences. Engage patients in discussions about their treatment options, incorporating their values and preferences into decision-making. What are the key components of a comprehensive physical therapy evaluation? Discuss how these components contribute to formulating an effective treatment plan. Answer: a comprehensive physical therapy evaluation includes several key components. Patient history. Gathering detailed information about the patient's medical history, previous treatments, and lifestyle factors is essential for understanding the context of their condition. Physical examination. This includes assessing range of motion, strength, posture, and functional mobility. Assessment of pain. Understanding the nature, intensity, and location of pain helps therapists identify underlying issues and tailor interventions. Functional assessment, evaluating the patient's ability to perform daily activities and participate in their desired activities, provides insights into the impact of their condition on their quality of life. These components contribute to formulating an effective treatment plan by identifying specific impairments and functional limitations that need to be addressed, establishing measurable goals based on the patient's individual needs and functional capabilities, tailoring interventions to target identified deficits and improve overall function. How can effective communication skills enhance patient outcomes in physical therapy? Provide specific examples of communication strategies that therapists can employ. Answer: effective communication skills are essential in physical therapy as they enhance patient outcomes through improved understanding and adherence to treatment plans. Key aspects include active listening. Therapists should practice active listening to ensure they fully understand the patient's concerns and goals. This can be achieved by paraphrasing the patient's statements and asking clarifying questions, educating patients. Clear explanations about diagnosis, treatment options, and expected outcomes empower patients to take an active role in their care. For example, using analogies or visual aids can help patients grasp complex concepts. Nonverbal communication. Body language, eye contact, and facial expressions convey empathy and support, fostering a positive therapeutic relationship. Therapists should be mindful of their nonverbal cues as they can significantly impact patient trust. Documentation. Clear, concise clinical notes that adhere to legal and ethical standards are vital for effective communication with other healthcare providers and for maintaining continuity of care. Mr. Thompson is a 65-year-old man with a history of osteoarthritis who presents with knee pain, significantly affecting his mobility. He expresses frustration about his condition and is hesitant to engage in physical therapy due to previous experiences of pain during exercise. As his physical therapist, what steps should you take to address Mr. Thompson's concerns while developing a suitable treatment plan? Answer: to effectively address Mr. Thompson's concerns and develop a suitable treatment plan, the physical therapist should take the following steps. Establish rapport. Begin by building a trusting relationship through active listening and empathy. Acknowledge Mr. Thompson's feelings about pain and validate his concerns. Educate the patient. Explain the role of physical therapy in managing osteoarthritis, emphasizing that controlled exercise can improve function and reduce pain. Use visual aids or examples of successful outcomes to illustrate potential benefits. Conduct a thorough evaluation. Perform a comprehensive assessment to identify specific limitations and pain triggers. This includes range of motion tests, strength assessments, and functional evaluations. Collaborate on goals. Involve Mr. Thompson in setting realistic and achievable goals based on his preferences and lifestyle. For instance, if he enjoys gardening, a goal could be to improve his ability to engage in that activity without pain. Develop an individualized treatment plan. Create a treatment plan that incorporates low-impact exercises and gradual progression. Consider modalities such as heat or cold therapy, as well as education on joint protection techniques. Monitor progress and adjust as needed. Regularly assess Mr. Thompson's response to treatment and modify the plan as necessary to ensure it remains aligned with his goals and comfort level. Guidelines. The APTA Guidelines for Patient-Centered Care stress the importance of communication and education in enhancing patient engagement and adherence to treatment plans. Define professionalism in physical therapy and discuss its importance in maintaining patient trust and enhancing the quality of care provided. Answer: professionalism in physical therapy encompasses ethical behavior, accountability, and adherence to established standards of practice. Its importance is highlighted in several ways. Patient trust. Demonstrating professionalism fosters trust between the therapist and the patient. Patients are more likely to engage in their treatment plans and adhere to recommendations when they feel confident in their therapist's competence and ethical standards. Quality of care. Professionalism ensures that therapists remain committed to providing high-quality care, adhering to evidence-based practices, and engaging in continuous professional development to enhance their skills. Ethical considerations. Upholding ethical principles such as beneficence, non-maleficence, and respect for patient autonomy is crucial in guiding clinical decision-making and ensuring that patient welfare is prioritized. Team collaboration. Professionalism extends to interactions with colleagues and other healthcare providers. Effective communication and mutual respect are essential for collaborative care, ultimately benefiting the patient. Describe the role of wearable devices in physical therapy. How can these technologies enhance patient engagement and improve treatment outcomes? Answer: wearable devices have increasingly become integral in physical therapy, offering several benefits that enhance patient engagement and improve treatment outcomes. Real-time data collection. Wearable devices can monitor patients' vital signs, activity levels, and biomechanical data in real time. This data enables therapists to assess progress and make informed adjustments to treatment plans. Enhance patient motivation. By providing immediate feedback on performance and progress, wearables can motivate patients to adhere to their exercise regimens. Features such as goal setting and achievement tracking foster a sense of accomplishment. Telehealth integration. Wearable technology can seamlessly integrate with telehealth platforms, allowing therapists to monitor patients remotely and provide timely interventions when necessary. Personalized interventions. Data from wearable devices can help therapists customize exercise programs to meet individual needs and track specific metrics related to recovery or rehabilitation. Explain the importance of quality improvement initiatives in physical therapy. How can therapists engage in these initiatives to enhance clinical practice and patient outcomes? Answer: quality improvement (QI) initiatives are essential in physical therapy as they focus on systematically improving patient care processes and outcomes. The importance of QI includes enhance patient safety. Implementing QI initiatives helps identify and mitigate risks, reducing the likelihood of errors and improving overall patient safety. Increased efficiency. By analyzing and streamlining processes, therapists can enhance the efficiency of care delivery, allowing for more effective use of resources and time. Evidence-based care. QI initiatives promote adherence to evidence-based practices by integrating research findings into clinical workflows, ensuring that care is based on the best available evidence. Patient satisfaction, engaging patients in QI efforts by soliciting feedback on their experiences, can lead to improvements in service delivery, thereby enhancing patient satisfaction. Therapists can engage in QI initiatives by participating in interdisciplinary QI teams within their institutions, collecting and analyzing data on clinical outcomes to identify areas for improvement, implementing evidence-based protocols and guidelines to standardize care. Guidelines. The APTA encourages therapists to engage in QI initiatives as part of their commitment to excellence in practice, providing resources and frameworks for implementing effective QI strategies. Discuss the role of integrative and complementary approaches in physical therapy practice. How can these approaches be effectively incorporated into conventional treatment plans? Answer: integrative and complementary approaches in physical therapy involve using various modalities and practices that complement traditional treatment methods. Their role includes holistic care. Integrative approaches address the whole person, considering physical, emotional, and social factors affecting health. This holistic perspective enhances the therapeutic relationship and improves treatment outcomes. Patient-centered care. By incorporating complementary techniques, e.g., acupuncture, massage, mindfulness, therapists can tailor treatment plans to individual patient needs, preferences, and cultural beliefs. Enhanced recovery. Some integrative approaches may promote relaxation and reduce pain, facilitating the recovery process. For example, incorporating mindfulness techniques can help patients manage stress and pain perception. To effectively incorporate these approaches, physical therapists can collaborate with practitioners of complementary therapies to develop comprehensive treatment plans, educate patients on the potential benefits and limitations of integrative techniques, ensuring informed consent, monitor and assess the impact of these approaches on treatment outcomes. Guidelines. The APTA supports the integration of evidence-based complementary therapies within the scope of physical therapy practice, emphasizing the importance of a patient-centered approach. Identify and discuss emerging trends in physical therapy practice that may shape the future of the profession. How should practitioners prepare for these trends? Answer: emerging trends in physical therapy that may significantly shape the profession's future include telehealth expansion. The continued growth of telehealth services presents opportunities for increased access to care. Practitioners should familiarize themselves with telehealth technologies and regulatory requirements to provide effective remote services. Artificial intelligence (AI). The integration of AI in clinical decision-making and patient management is on the rise. Practitioners should stay informed about AI developments that could enhance diagnostics and treatment personalization. Focus on preventive care. There is a growing emphasis on preventive care in physical therapy, aiming to address issues before they become significant problems. Practitioners should develop strategies to educate patients on injury prevention and wellness. Interdisciplinary collaboration. Future trends indicate a shift towards more collaborative care models. Practitioners should cultivate skills for effective teamwork with other healthcare professionals to provide comprehensive patient care. Describe the structure of the knee joint, including its classification, major ligaments, and the role of menisci. What implications do these anatomical features have for rehabilitation strategies following a knee injury? Answer: the knee joint is classified as a hinge joint, primarily allowing flexion and extension. Its anatomy includes bones. The femur, tibia, and patella form the main components. Ligaments. Major ligaments include the anterior cruciate ligament, ACL, and posterior cruciate ligament, PCL, which provide stability by controlling the movement of the tibia relative to the femur. The medial and lateral collateral ligaments, MCL and LCL, provide side-to-side stability. Menisci. These are two crescent-shaped cartilages, medial and lateral menisci, that act as shock absorbers and improve joint congruence. In rehabilitation, understanding this anatomy is crucial for developing interventions that restore joint stability and range of motion while preventing further injury. For instance, exercises that strengthen the quadriceps can help compensate for ACL deficiencies. Explain the sliding filament theory of muscle contraction, detailing the roles of actin and myosin filaments. How does the process of muscle contraction relate to energy expenditure? Answer: the sliding filament theory describes how muscle contraction occurs at the microscopic level through the interaction of actin and myosin filaments. Activation: when a motor neuron fires, it releases acetylcholine, leading to depolarization of the muscle fiber, release of calcium ions from the sarcoplasmic reticulum. Binding: calcium binds to troponin, causing tropomyosin to shift and expose myosin binding sites on the actin filaments. Cross-bridge formation: Myosin heads attach to these binding sites, forming cross bridges. Power stroke ATP hydrolysis powers the movement of the myosin heads, pulling the actin filaments toward the center of the sarcomere, thus shortening the muscle release. New ATP molecules bind to myosin, causing it to release actin, allowing the cycle to repeat. This process requires significant energy, primarily derived from ATP. The rate of ATP production and consumption is influenced by the type of muscle fibers, slow twitch versus fast twitch, which affects endurance and strength performance. Discuss the functional areas of the brain and their roles in motor control and sensory processing. How might an injury to a specific area affect physical therapy interventions? Answer: the brain can be divided into several functional areas, including motor cortex, controls voluntary movement and is located in the frontal lobe. Injury here may lead to weakness or paralysis, necessitating specific strength and motor control rehabilitation. Sensory cortex processes sensory information and is located in the parietal lobe. Damage could impair proprioception, requiring interventions focused on sensory re-education. Association areas involved in integrating sensory input and motor planning. Damage might affect higher cognitive functions, impacting a patient's ability to follow rehabilitation instructions. In physical therapy, understanding these areas helps tailor interventions to specific deficits, enhancing recovery. Mr. Thompson is a 55-year-old male who recently underwent a total knee replacement due to severe osteoarthritis. He is struggling with postoperative pain and has difficulty bending his knee. What specific interventions should Mr. Thompson's physical therapist implement to facilitate recovery while managing his pain effectively? Answer: Mr. Thompson's rehabilitation should include the following interventions: pain management. Modalities such as cryotherapy, ice application, or electrical stimulation can help reduce pain and inflammation. Range of motion exercises. Gradual guided exercises focusing on flexion and extension should be introduced, starting with passive movements before progressing to active assistance. Strengthening exercises, emphasizing the quadriceps and hamstrings, will support joint stability. Closed chain exercises, e.g., mini squats, can be beneficial once initial pain decreases. Functional training, teaching Mr. Thompson to perform daily activities like standing from a seated position safely, gradually integrating functional tasks to improve mobility. Effective communication with Mr. Thompson about expectations and progress will be vital in ensuring adherence to the rehabilitation program. How does the cardiac cycle affect blood pressure regulation, and what role does the autonomic nervous system play in this process? Answer: the cardiac cycle comprises two main phases: systole, contraction, and diastole, relaxation. During systole, the heart pumps blood into the arteries, causing an increase in blood pressure, systolic pressure. During diastole, the heart fills with blood and the pressure decreases, diastolic pressure. Blood pressure regulation involves autonomic nervous system. The sympathetic nervous system increases heart rate and myocardial contractility during stress, raising blood pressure. Conversely, the parasympathetic system reduces heart rate and helps lower blood pressure during rest. Baroreceptors. These receptors in the carotid arteries and aorta detect changes in blood pressure and send signals to the brain to adjust heart rate and vascular resistance accordingly. Physical therapists should consider these mechanisms when designing cardiovascular rehabilitation programs, especially for patients with hypertension or heart failure. Explain the mechanics of breathing, including the role of the diaphragm and accessory muscles. How might an understanding of these mechanics influence physical therapy strategies for patients with respiratory conditions? Answer: breathing involves two primary processes, inhalation and exhalation. During inhalation, the diaphragm contracts and moves downward, increasing the thoracic cavity volume, which creates a negative pressure that draws air into the lungs. Accessory muscles such as the intercostals, sternocleidomastoid, and scalene assist during deep or labored breathing, especially in conditions like COPD or asthma. During exhalation, the diaphragm relaxes and the elastic recoil of the lungs and chest wall pushes air out. In physical therapy, understanding these mechanics is essential for developing pulmonary rehabilitation strategies that include breathing exercises to improve ventilation, strengthen respiratory muscles, and enhance overall lung function. Describe the pathophysiology of osteoarthritis and discuss how physical therapy can address the functional limitations associated with this condition. Answer: osteoarthritis (OA) is characterized by the degeneration of articular cartilage and changes in the underlying bone. Key features include cartilage breakdown. Loss of cartilage leads to increased friction and bone-on-bone contact, resulting in pain, stiffness, and loss of function. Bone changes. Osteophyte formation and subchondral bone sclerosis occur as the body attempts to stabilize the joint. Physical therapy interventions for OA focus on pain management. Techniques like ultrasound, T, NS, and thermal modalities can help alleviate pain, strengthening, targeting muscles around the affected joint to improve stability and reduce load on the joint. Range of motion. Gentle stretching and mobility exercises can combat stiffness. Education. Teaching patients about joint protection strategies and activity modifications to manage symptoms effectively. Compare and contrast acute and chronic injuries in terms of their mechanisms and implications for physical therapy interventions. Answer: acute injuries occur suddenly, often due to a specific trauma, while chronic injuries develop gradually over time, usually from repetitive stress. Acute injuries. Common examples include sprains, strains, and fractures. They require immediate care to manage pain, inflammation, and stabilization. Treatment may involve CE, rest ice compression elevation, followed by a structured rehabilitation program focusing on restoring range of motion and strength. Chronic injuries. Examples include tendonitis and stress fractures, often linked to overuse. Treatment focuses on addressing biomechanical issues, modifying activity levels, and implementing gradual strengthening programs to prevent recurrence. Physical therapists must recognize the differences in mechanisms to tailor their treatment approaches appropriately. Describe the differences between aerobic and anaerobic metabolism in terms of energy production, efficiency, and relevance to physical therapy practices. Answer: aerobic metabolism occurs in the presence of oxygen, efficiently producing ATP through the oxidation of carbohydrates and fats. Key features include energy yield, approximately 36 ATP per glucose molecule. End products: carbon dioxide and water, which are easily cleared from the body. Anaerobic metabolism occurs without oxygen, providing quick bursts of energy for high-intensity activities, but with limited capacity. Energy yield: approximately 2 ATP per glucose molecule. End products: lactic acid, which can lead to muscle fatigue. In physical therapy, understanding these metabolic pathways is crucial when designing rehabilitation programs. For instance, programs for endurance athletes may emphasize aerobic conditioning, while interventions for sprinters may focus on anaerobic strength and power development. Discuss the considerations a physical therapist must take into account when treating pediatric patients with developmental disorders. What therapeutic strategies could be employed? Answer: when treating pediatric patients with developmental disorders, physical therapists must consider growth and development. Therapists need to account for the child's age, stage of development, and physical growth patterns, as interventions should promote functional skills appropriate for their developmental level. Family involvement. Engaging family members in therapy is crucial to ensure carryover of skills and support for the child's progress at home. Individualized treatment plans. Programs must be tailored to the specific needs and capabilities of the child, integrating play-based activities to facilitate engagement and motivation. Therapeutic strategies may include gross motor skill development, activities such as climbing, jumping, and balance exercises tailored to the child's abilities. Fine motor skill enhancement, incorporating hand-eye coordination activities through games and crafts. Strengthening programs, focused on core and extremity muscles to support overall function. Why is a comprehensive patient history crucial in the physical therapy evaluation process, and what are the key components to include in this history? Answer: a comprehensive patient history is vital as it informs the physical therapist about the patient's background, current condition, and potential risk factors that may affect treatment outcomes. The key components to include in a patient history are chief complaint, CC, the primary reason the patient seeks therapy, history of present illness, HPA, a detailed exploration of the current condition, including onset, duration, location, and characteristics of symptoms. Past medical history, PMH, includes previous illnesses, surgeries, and treatments that could impact current therapy, medications. A list of current medications and any known allergies. Social history, lifestyle factors that may influence rehabilitation, such as occupation, physical activity level, and support systems. Review of systems, ROSE, a systematic review of various body systems to identify any additional issues that may be relevant to the patient's condition. How do active listening and building rapport with patients enhance the effectiveness of the physical therapy process? Answer: active listening and rapport building are essential components of effective communication in physical therapy. They enhance the therapy process in several ways. Understanding patient concerns. Active listening allows the therapist to fully grasp the patient's concerns and feelings, ensuring that treatment plans align with their expectations and needs. Trust building. Establishing rapport creates a trusting relationship, encouraging patients to be more open about their symptoms and progress, which can lead to more accurate evaluations. Improve compliance. When patients feel understood and valued, they are more likely to adhere to treatment plans and participate actively in their rehabilitation. Feedback mechanism. Active listening facilitates better feedback, enabling therapists to adjust treatment plans based on patient responses and concerns. Mr. Thompson is a 65-year-old patient who presents with difficulty maintaining balance and frequent falls. During your evaluation, you performed several neurological assessments. What specific tests would you conduct to evaluate Mr. Thompson's balance and coordination, and what would you be looking for in the results? Answer: in evaluating Mr. Thompson's balance and coordination, the following neurological tests should be conducted. Romberg test, assessing static balance with eyes closed. A significant sway or loss of balance indicates proprioceptive deficits or vestibular dysfunction. Finger-to-nose test, evaluating coordination. Inaccurate or hesitant movements may suggest neurological impairment. Timed up and go test, TUB, assessing dynamic balance and functional mobility. A prolonged time indicates potential instability or risk of falls. Berg Balance Scale, a comprehensive assessment of various balance tasks to quantify balance ability. The results of these tests will help determine the underlying cause of Mr. Thompson's balance issues and guide appropriate interventions. Explain the importance of posture analysis in the physical therapy evaluation and what specific alignments and asymmetries a therapist should assess. Answer: posture analysis is critical in physical therapy as it provides insights into musculoskeletal imbalances and can reveal underlying issues that may contribute to pain or dysfunction. Key aspects to assess include alignment, the alignment of the head, shoulders, spine, hips, knees, and ankles. A deviation from normal alignment may indicate muscle imbalances or structural abnormalities. Asymmetries. Observing differences between left and right sides of the body can indicate previous injuries, chronic pain patterns, or compensatory strategies. Common asymmetries to look for include shoulder elevation, pelvic tilt, and leg length discrepancies. Functional implications. Poor posture can lead to increased strain on muscles and joints, contributing to pain and reduced functional capacity. Identifying and correcting postural issues is essential for effective treatment and prevention of future injuries. Discuss the significance of both passive and active range of motion assessments in the physical therapy evaluation process and how each contributes to understanding the patient's condition. Answer: range of motion (ROM) assessments are vital for understanding the functional capabilities of a joint and the overall mobility of a patient. The significance of each type includes passive range of motion (PROM), assessed by the therapist moving the joint without the patient's assistance. It helps determine the integrity of the joint structure and surrounding soft tissues. Limitations in PROM may indicate joint stiffness, soft tissue restrictions, or neurological impairments. The active range of motion (AROM) involves the patient moving the joint independently. AROM assesses the patient's willingness to move and muscle strength. Limitations here can reveal muscle weakness, pain, or neurological deficits. Documentation and progress tracking. Regular ROM assessments provide valuable data for tracking progress and adjusting treatment plans, guiding interventions to improve mobility and functional outcomes. How does manual muscle testing contribute to the overall evaluation of a patient's physical function, and what are the limitations of this technique? Answer: manual muscle testing (MMT) is crucial for evaluating a patient's muscle strength, which informs treatment planning and rehabilitation strategies. Its contributions include assessment of muscle function. MMT provides insights into specific muscle weakness or imbalances, helping identify areas requiring targeted intervention. Establishing baselines. MMT results establish baseline strength levels, which are essential for tracking progress throughout therapy. Functional implications. Understanding muscle strength helps determine the patient's capacity for daily activities and participation in rehabilitation exercises. Limitations. Subjectivity. MMT can be subjective and depend on the therapist's experience and interpretation. Variability. Factors such as pain, fatigue, and patient cooperation can affect results. Limited insight. MMT primarily assesses strength and does not account for endurance, coordination, or functional performance in real-life scenarios. What role does MRI play in the assessment of soft tissue injuries in physical therapy, and what specific conditions can it help diagnose? Answer: magnetic resonance imaging (MRI) is a critical diagnostic tool in physical therapy for assessing soft tissue injuries due to its ability to provide detailed images of muscles, ligaments, tendons, and cartilage. Its role includes soft tissue evaluation. MRI effectively visualizes soft tissue structures that are not visible on X-rays, enabling the detection of tears, sprains, and inflammation. Diagnosis of specific conditions. Common conditions that can be diagnosed using MRI include rotator cuff tears, identifying tears in the shoulders, rotator cuff muscles, meniscal tears, evaluating the knees menisci for tears or degeneration, tendonitis, detecting inflammation in tendons such as Achilles tendonitis, ligament injuries, assessing injuries to ligaments such as anterior cruciate ligament, ACL tears. Overall, MRI aids in developing accurate treatment plans by providing clear images of the injury, thereby facilitating targeted rehabilitation strategies. How do common laboratory tests inform physical therapy practice, and what specific markers might be relevant for assessing a patient's readiness for rehabilitation? Answer: laboratory tests provide essential information that can inform the physical therapy approach and assist in assessing a patient's overall health status. Relevant tests and markers include complete blood count (CBC). It evaluates overall health, detects anemia, and identifies infections or other disorders. Low hemoglobin levels may affect exercise tolerance. Electrolytes. Monitoring sodium, potassium, calcium, and magnesium levels is vital, as imbalances can impact muscle function and hydration status. C-reactive protein (CRP), a marker of inflammation that can help identify inflammatory conditions. Elevated CRP may indicate the need for modified activity levels during therapy. Liver function tests, important for patients on medications that may affect liver health, guiding the therapist on contraindications for specific exercises. Understanding these markers helps therapists tailor rehabilitation programs to the patient's medical status and ensure safety throughout the treatment process. What are the key components to evaluate during gait analysis, and how can deviations in gait patterns indicate underlying musculoskeletal or neurological issues? Answer: gait analysis is essential for identifying deviations that may suggest musculoskeletal or neurological issues. Key components to evaluate include cadence, the number of steps taken per minute. Decreased cadence may indicate weakness or fatigue. Stride length, the distance covered in one step. Reduced stride length may be associated with pain or joint restrictions. Symmetry, comparing the movement of both legs. Asymmetry can indicate underlying injuries or conditions affecting one side more than the other. Knee and hip motion, observing flexion and extension patterns during gait can highlight abnormalities such as compensatory movements due to pain or weakness. Implications: deviations from normal gait patterns can suggest specific pathologies such as Trendelenburg gait, associated with hip abductor weakness leading to a hip drop on the opposite side. Antalgic gait, characterized by a shortened stance phase on the affected side due to pain, indicating potential injury. Describe the significance of joint-specific tests in the physical therapy assessment process and provide examples of tests for the shoulder and knee joints. Answer: joint-specific tests are crucial in physical therapy for diagnosing conditions, evaluating joint integrity, and determining appropriate rehabilitation strategies. Their significance lies in targeted assessment. These tests allow therapists to isolate and evaluate specific joints for injuries, instability, or dysfunction. Differential diagnosis. They help differentiate between various conditions affecting a joint, guiding treatment decisions. Treatment planning. Results from these tests inform the development of targeted therapeutic interventions. Examples: shoulder joint tests. Hawkins-Kennedy test evaluates for shoulder impingement by flexing the shoulder and elbow while internally rotating the arm. Positive findings indicate possible rotator cuff pathology. Apprehension test assesses shoulder instability by positioning the arm in abduction and external rotation. A positive result suggests instability or previous dislocations. Knee joint tests. Lachman test evaluates anterior cruciate ligament ACL integrity. An increased anterior translation of the tibia indicates a possible ACL tear. McMurray test assesses for meniscal tears by applying varus and valgus stress while flexing and extending the knee. A click or pain during the test suggests a meniscal injury. Understanding the significance and application of these tests is essential for effective assessment and treatment in physical therapy.